Hello, Epic Readers. We are here today with Dr. Kremer and Sandi Star, both from Del Mar Functional Medicine, which is a part of Del Mar Integrative Medicine. And Dr. Kremer is here to tell us today what exactly is functional medicine.
Thank you. Functional medicine is a way to diagnose medical problems that uses a different labs than is traditionally used in conventional medicine. In conventional medicine, you see a physician. He takes 10 minutes to examine you and ask you a couple of questions, does some lab tests, and say, coming back, we'll review your labs. Many people have been going to several doctors and never actually got to the root cause of what's the matter with them. And so functional medicine, we do a certain amount of tests, none of which are blood tests. We use saliva, and we do a GI test, and we do a urine test, and we can determine exactly how you're metabolizing everything in your body,
Right.
and what things are out of balance.
And inflammation markers in the gut, dysbiosis, which is imbalance in bacteria, so we can see the microbiome. We can see so much of what's going on just in the gut. And then, of course, the stress test. We're looking at adrenal health, cortisol hormone, that type of thing.
So cortisol, many people may not realize it. Everybody probably knows the term cortisol, but cortisol is a stress hormone. And when you're under a lot of stress, like if you see a grizzly bear coming at you, your cortisol level is going to go through the roof because your legs are going to run as fast as they've ever run. And then when when you've gotten rid of the bear, if he didn't get rid of you, the cortisol level comes down again and normalizes. Well, most people are walking around with chronic stress where that cortisol level is staying elevated, and that could be related to a million different things. It could be related. It literally could be related to something that happened when they were a kid. Maybe they lost a loved one, or they were in a car accident or something, and that's always remained with them. That stress has always remained with them. Conventional medicine doesn't address that, so we check your cortisol levels. We have natural supplements that can bring them down. We also know that elevated cortisol levels cause a decrease in your immune system. So your immune system doesn't work correctly. Many people don't know that the microbiome, your gut, it controls 70% of your immunity, which is one of the reasons we check the gut. And it's really, I've been amazed because there's so many people that have what's called a dysbiosis. That's where, it's just an imbalance in the gut. It could be an overgrowth, could be overgrowth of one bacteria over another. And it affects your the way your gut works and the way your immunity works.
That's your foundation, is your gut. And when you're not absorbing right, when you have leaky gut, that systemically affects us pretty severe. We have neurotransmitters that are happening. It affects so much in the gut that's the core, and we definitely work on that core. That's a big area.
Yeah,
sure.
And that's very important. One of the problems, I think, with chronic stress is that because it's chronic, you might not even necessarily know that you're in stress.
Yes.
Because you get used to it, right?
Right, exactly. And that's one, in fact, and that's one of the things we do is we get a timeline. You fill out some paperwork, answer questions about things that's happened in your life, and we get a timeline. Like cool. I'll ask a patient, well, how long have you been having whatever symptom they have? And they said, well, it's been going on for probably 5 years. And I said, and we look at their timeline and say, well, look what happened back here 5 years ago. You were in a major car wreck. Does that seem to be maybe one of the things that started this whole chronic stress thing? So we can we can look at that and we can treat it. We treat with natural supplements. We want to get that. We want to get that cortisol level down. For example, I'm an emergency physician by certification. I was in the emergency department for literally decades, and when I first started in functional medicine, I got my own test done, and my cortisol level, this is interesting, my cortisol level would shoot up at 3 in the afternoon. And I'm saying, why did it shoot up at 3 in the afternoon? You know, and it's because I used to go to the emergency department, start my shift at 3 in the afternoon, and work till 7 in the morning.
Yeah.
And it never corrected. You know, and so these are the things we find out by knowing your timeline, knowing what's been going on in your life, and addressing it.
That makes perfect sense.
Right. It's really going deep. There's stressors that trigger things. And there's 3 stages of burnout as well. And so we try to figure out, okay, which stage is this person in? And then we address it accordingly.
And burnout's a big issue right now.
It is huge right now.
And pandemic-induced fear and stress are big issues.
Yes.
And it's nice to have this resource in our community. And also, if you are not local to Del Mar, you offer telehealth, right?
Yes.
We offer telehealth, and literally we can do that all over the world. You know, we can send. I mean, our tests. None of them are blood tests, although there are. Sometimes you want to do blood tests, but most of our tests are not. They're saliva, gastrointestinal stool samples, and urine. And urine, we get organic acids. Literally, can tell exactly how you're metabolizing. We can send those tests all over the world, and the patients will take it out, do it, and then we do a Zoom call on them, or whatever format we're using, but where we can see them in purpose, in face to face, and talk about these things. You know, go over the results, and really what functional medicine really comes down to eventually is lifestyle change, because most people who come in that are chronically stressed, I mean, we get people have the same 5 complaints.
That's right.
I'm overweight, I have brain fog, I'm anxious, my hormones are off, and I just can't function right, and so how am I supposed to, if everybody has the same complaints, I can't say, well, we'll just give you this medication.
It's very individualized.
Let's find out why you're feeling these things.
Right.
And that's what we do with these tests. And these, I'll say to a patient, I say, well, we have to do some tests to figure out why you've been feeling, why you've been feeling brain fog, or why your hormones are off, and so forth.
That makes perfect sense, because the tests give you the roadmap. And one thing I've noticed is that in Western medicine, that sometimes the doctor says you can't have that test when I ask for a specific test.
Yeah.
So it's nice that you can go someplace and say, you don't have to think about, okay, what kind of test I need. You're already going to be thinking about that for me.
Yeah.
Right.
And not saying, no, you can't have these tests.
Yeah.
One of the interesting things, just as an example, some women have hormone imbalances and problems, and we have found that 70% of the women that have hormone imbalances can be corrected by correcting their stress levels. Yeah. Instead of like giving, I'm just going to put you more on the, give you more estrogen or more progesterone or something like that, or take it away or whatever. Let's get the stress under control, and a lot of that will go away.
Yeah,
right, that makes perfect sense, and that you are helping treat the underlying condition, and you're teaching them lifestyle changes.
Yes,
your patient's lifestyle changes, so that you, as a patient, you can be in control of your health, your future health.
We definitely encourage that.
Right?
Yeah. I mean, that's what it really comes down to, But we have to get, people are resistant to change. We're all love our habits, and that's not necessarily bad. I mean, we have to have a habit force that keeps us going, but sometimes our habits are destructive, and so through getting patients balanced a little bit, and then they see, well, I'm actually feeling better.
Yeah.
Then we can start to gear them into some things that are just healthier ways of living. Like I'll tell patients, while I'm waiting for their test, I'll say, while I'm waiting for your test, do me a favor, and just, if you can do this just for a couple of weeks until your tests come back, give up dairy and give up gluten. And I've had patients come back to me when I have all their tests back, even before they've seen their tests or anything, that, doc, I feel better already.
Right.
So, and then we try to get them, we obviously emphasize exercise. I mean, everybody knows that exercise is important, but there's so many people that just say, I don't have the time for it, I'm too busy doing this, which just means they're chronically stressed.
And their priorities are backwards.
Yeah.
So,
Right. Well, that's the other part of chronic stress is that it's hard to get your priorities in order because you can't function at your optimum level to think about your priorities and getting them in order.
Yes.
Right.
And so, Dr. Kremer, you have a background in emergency medicine, and Sandi, as his partner in Del Mar Functional Medicine, tell us a little bit about your background.
Sure. So I'm a holistic practitioner and clinical nutritionist. I've also studied herbology. And so I definitely do the supplementation, diet, nutrition. Diet just means an assembly of food. And so diet seems to be a scary word for a lot of people. And so really for me, it's really important that people understand why they're eating what they eat, not counting calories, but counting food and portions. And not making it complicated, but also being able to understand why cow dairy is inflammatory and the protein's big, why gluten's an issue. I mean, I wrote a book on gluten, and I'm an advocate for that because there's many reasons why gluten is toxic. And so it's just really letting people understand that aspect, but they take control. The more they understand, the more they implement. And with functional medicine, it's a process. And the important thing is to make adjustments along the way that weave into a lifestyle where there's positive changes, but not taking all this stuff away, and then they do it for a month and then they're back to their habits. It's a technique, really, to be able to work with somebody like that.
Right, so it makes sense to enter into a longer-term relationship with both of you, because you invest the time now, you make the commitment now, you invest the time now, and then you can be in control of your future health and and not have to rely on possibly a prescription medication that you may have to be on for the rest of your life. Instead, you get to be in the driver's seat, right?
And many of these, many things that we're addressing have been going on for years in a patient. So I mean, we're not going to cure it in 2 days. And so people, usually people will take at least 6 months. I mean, we don't even do retesting. Usually, we don't do retesting until they've been on the supplements for 6 months. And we encourage lifestyle. We encourage exercise and meditation. And not everybody's going to do it. But you know what? If the people who come to us who are invested in their own change and say, hey, I'm going to do this, are more likely to follow through and continue to improve in other ways.
And they see real results. I mean, that's the biggest thing. We give people results because a medication is only going to mask a symptom, but the problem's still there. When we get underneath that current and start working on that, then that current calms down. And so the body tends to balance and gets homeostasis naturally when you're dealing with these underlying causes and triggers and getting to the root. So it makes a big difference. I'll tell you, with me, I was diagnosed with autoimmune IBS. I had migraines since I was 6. So it was headaches all the time. It wasn't until I went this route, which inspired me to go back to school. No autoimmune, none of the nuclear antibodies come up on labs for me. It's gone. I had Sjogren's. Migraines are gone, IBS is gone. I mean, you name it. It's like a list of things because I approached it by getting to the root cause. And it's a lifetime commitment, but it is beyond worth it, because you're not walking around in a fog or sick all the time. And then whole families are changed because of that. It's pretty awesome.
So you make the initial investment and then it pays off for the rest of your life.
And we give people the tools and the insight and the support that they can take those reins and they can, get on a path that's a healthy way. So, for sure.
Yeah.
And I really love that you're offering Epic readers a free introductory consultation.
Yeah.
And so we will put in the show notes exactly how you can access that consultation.
Yeah.
And do you have the herbs and supplements directly in your office, or?
We have some in the office, but because we're doing a lot of virtual, we can send it out. There's a couple platforms we use that we get a prescription for our herbs that sends it directly to the patient.
So it's our online dispensary.
Okay.
Yeah, so it just drop ships right to the patient.
All right.
Super easy. Lab kits are sent right to the patient.
It's all very convenient.
Yeah, it is very convenient, for sure.
All right. Well, thank you both for being here. I appreciate it.
Thank you.
Yeah.
And it's really nice to introduce the benefits that you have to our readers. So thank you.
Hope to see you soon.
Thank you.